We all know about the dangers of a leaky gut, but what if it could be happening inside our body? This video will tell you about the leaky gut syndrome. What are the signs and symptoms and how to prevent it? Watch it now and learn the importance of a healthy gut. Leaky gut syndrome. What is it? A gastrointestinal condition called the leaky gut syndrome affects the lining of the intestines. Given how challenging it is to diagnose leaky gut, there is some debate regarding whether the condition genuinely exists as how it is now understood. In any case, when someone is thought to have this disease, tight junction in the gut walls may not be functioning properly, leading to microscopic holes that allow bacteria and other poisons to enter the bloodstream. In patients with illness like Crohn's disease, increased intestinal permeability is frequently observed. The gastrointestinal tract runs from your gums to the bum and is a network of interconnected organs. The esophagus, stomach, and small and large intestines are the organs that make up the GI tract. Simply said, the stomach and small intestines' digestive enzymes break down the nutrients in food and liquids. The body then uses these smaller molecules for energy, growth, and repair. When it comes to including the body from toxic substances and harmful germs, the intestines are essential. Water and these nutrients can enter the bloodstream through the small gaps in the intestinal walls, but the toxic compounds remain outside. As a result of hyperpermeability brought on by the widening of these pores in leaky gut syndrome, the food particles, microbes, and toxins can now enter the circulation directly. Numerous bacteria that maintain the healthy immunological function, aid in digesting, and preserve the intestinal wall reside in the intestines. According to research, LGS may entail microbiota abnormalities that set off the body's immune system, causing gut inflammation and increased intestinal permeability. What signs and symptoms indicate the leaky gut? The medical establishment as a whole does not fully acknowledge leaky gut, also known as increased permeability, making it difficult to identify symptoms. It is challenging for doctors to diagnose the ailment because many of the symptoms are similar to those of other medical conditions. The following potential symptoms may result from or be influenced by leaky gut: constant bloating, diarrhea or constipation, nutritional inadequacies, joint discomfort, headaches, dizziness, confusion, difficulty concentrating, skin issues such as acne, rashes, or eczema, skin fatigue. It is unclear if LGS is a cause or a symptom, although it has been connected to a number of conditions, including irritable bowel syndrome, Crohn's disease, celiac disease, diabetes, and food allergies. Increased intestinal permeability may potentially aid in the onset of inflammatory bowel disease, according to a peer-reviewed study. Before any definitive findings can be made, more peer-reviewed research must be done. The link between the GI tract and the brain, known as the gut-brain axis, also has been extensively studied by scientists. What raises your chances of having a leaky gut? Although the exact etiology of leaky gut syndrome is yet unknown, there are a number of risk factors that can disturb the gut microbiota and promote the intestinal permeability. Alcohol consumption, poor diet, infections, autoimmune disease, diabetes, and stress are just a few examples. Is leaky gut test available? While it has already been said the diagnosis is extremely challenging, it is not impossible. There is one particular test that some doctors will perform to assess the intestinal permeability. The mannitol and lactose test is the name of the procedure. These two molecules are both water-soluble yet useless to the organism. People with healthy digestive linings may easily absorb mannitol, whereas the lactulose is a bigger molecule and is only marginally absorbed. After being told to consume a mixture of containing both of these substances, a person's urine is then collected for 6 hours. A healthy test will show high levels of mannitol and low levels of lactulose, which indicate how much was absorbed by the body. High levels of one or both suggest greater intestinal permeability. Low levels of either or both indicate generally inadequate nutrition absorption. The majority of doctors avoid using these tests since they don't think it's particularly reliable. Increased intestinal permeability is also a sign of many other illnesses, so it shouldn't be used to rule out other illness because doing so can prevent a patient from receiving care for a more serious ailment they might be suffering from. It is advised to consult a gastroenterologist for guidance as they are experts in GI tract and digestive health. What procedure can repair a leaky gut the quickest? Given that leaky gut is not a recognized medical illness, there are currently no FDA approved cures for the issue. Instead of treating leaky gut as a symptom of the underlying problem they have identified, a person is more likely to receive treatment recommendations from their doctor that are concentrated on that condition. For instance, any anti-inflammatory medicines, immune system suppressors, antibiotics, pain relievers, and vitamins to assist the lining of your gut. Recover may be used as treatment for inflammatory bowel disease. Which foods are best to stay away from if you have a leaky gut syndrome? Your doctor may advise changing your diet to eliminate inflammatory foods that might affect gut flora, such as processed foods, high-fat foods, refined oils, high-sugar foods, foods that could cause allergies and sensitivities, alcohol. It is crucial to consume a diet full of items that promote the development of healthy gut flora. Vegetables, including fermented vegetables, roots, fruits, sprouted seeds, seafood, cultured dairy products, if no dairy sensitivity exists, and almonds are some excellent alternatives. Thank you for watching my video. Subscribe to get regular updates on my channel.